Do you frequently feel like your heart pains sometimes? Or maybe your hands and feet often feel numb, like when your leg falls asleep, but it doesn't go away. What if your skin started looking weird, or your tongue got unusually thick? These might seem like small things at first, but when they happen together, they could be signs of something bigger. That's where amyloidosis comes in. Imagine tiny, sticky proteins, like glue gone wild, building up in your organs. Over time, this buildup can hurt the heart, kidneys, nerves, and other parts of your body. It's rare but very serious. And the tricky part, people often miss the signs because they look like other common problems. So, what causes these rogue proteins to build up? Normally, your body makes proteins that help it work properly. But sometimes, due to certain health issues, the body starts making abnormal proteins called amyloids. Think of it like a factory making the wrong product. Instead of useful items, it starts dumping junk that the body can't clean up. This can happen if you have long-term infections, like tuberculosis, chronic kidney disease, or certain blood disorders like multiple myeloma. In some cases, it can even run in families, meaning your genes might give you a higher chance. There's also a type that mostly affects older people, especially men, where the heart gets filled with amyloid from a protein called transthyretin. So causes vary, some from genes, some from other diseases, some just from aging. Now, how do you know if you might have amyloidosis? Let's play detective. Have you dropped things a lot lately? Like your coffee cup slips from your hand for no reason? That could be nerve damage. Is your belly swollen, or do you pee less than before? That might mean your kidneys are struggling. Does your heart beat too fast, or do you get breathless walking to the mailbox? That's a red flag for heart involvement. Some people even notice their tongue looks bumpy or swollen, like a beefy red tongue. Another clue, if you get carpal tunnel syndrome in both wrists, not just one, and you're not doing heavy work, it might not just be wrist strain. Amyloidosis spreads quietly, like moss on a wall, slowly covering organ surfaces. The symptoms depend on which organ is affected, so it can look different in different people. Diagnosing amyloidosis is like solving a mystery. Doctors can't just guess, they need proof. First, they'll look at your symptoms and medical history. Then they might take a small piece of tissue, a biopsy from your belly fat, gum, or even a swollen organ. Under a special microscope, amyloid glows a certain way, kind of like glow in the dark paint. Blood and urine tests help find abnormal proteins. If the heart is involved, an echocardiogram, a heart ultrasound, might show it's thick and stiff. Once confirmed, treatment starts. It's not about one pill, it's a team attack. If it's linked to a blood disorder, chemotherapy-like drugs are used to stop bad protein production. For the type affecting the heart, new drugs actually help remove the amyloid. Some people might need organ transplants. But the goal is always, stop more buildup, remove what's there, and help organs heal if possible. Can we prevent amyloidosis? The honest answer is not fully, but we can reduce risks. Think of it like protecting your house from termites. If you know there's a family history, genetic testing might help. Regular checkups and early treatment of conditions like myeloma or chronic inflammation are key. Avoid long-standing infections, get them treated early. For the type that runs in families, called familial amyloidosis, some people now get special medicines early, even before symptoms, to stop the disease. Healthy living, like eating well, managing blood pressure, and avoiding smoking, also helps your organs resist damage. So while we can't stop every case, we can definitely lower the odds through awareness and action. Science is making progress. Imagine a drug that doesn't just slow the disease, but actually removes the amyloid junk. That's happening now. New medicines like tafamidis help stabilize the transthyretin protein, so it won't misfold and build up, especially good for heart-related amyloidosis. Gene-silencing drugs like patisiran and inotersen tell the liver to stop making the bad protein, like turning off a broken faucet. Researchers are also working on amyloid-clearing antibodies, special molecules that find and destroy amyloid deposits, almost like Pac-Man eating dots. Early detection is improving too. Advanced scans can now spot amyloid in the heart without a biopsy. All of this means better quality of life and longer survival. Hope is growing faster than the amyloid spreads.